So, so alcohol abuse occurs when someone drinks enough that it puts the relationships, job, or health in jeopardy. 2. Which of the following represents the purpose of an open-ended question? Answering answer um, producing maximal freedom of response. 3. Which of the following exhibits the most personal behavior by the dentist? Touching patient gently on arm. 4. Which of the following most accurately explains how biofeedback works? Enables the patient to gain control of certain physiological functions. 5. The characteristics of effective punishment include each of the following except one. Which one is the exception? Which characteristic does not include the effective punishment characteristic? The answer is it does not include maximum intensity. 6. Stress and illness are often related. The best description of the relationship is which of the following? Answer is stress is contributory to illness, and illness is usually stressful. 7. Which of the following is seen most frequently among chronic TMJ disorder patients? Answer is A. Depression. Which of the following is seen most frequently among chronic temporomandibular joint disorder patients? Depression. 8. For a patient with multiple sclerosis, epinephrine is contraindicated in local anesthetic. 9. Each of the following is a common reason for early retirement of dentists except one. Which one is the exception? The mercury toxicity syndrome is not a usual reason for retirement. 10. Which of the following represents the median of the data set below? 1, 1, 1, 1, 2, 2, 3, 3, 7, 9. Answer is the median is the right in the middle. Number right in the middle, it's number 2, which is B. Next, 11. The ability of a patient to make choices among treatment options represents the concept of autonomy. Again, the ability of a patient to make choices among treatment options represents autonomy. 12. According to the American Dental Association publication entitled Principles of Ethics and Code of Professional Conduct, a dentist can announce specialization in which of the following? The answer is dental health. A patient can um, announce specialization in public health. Dental public health. Next, for a population, the researcher divides the number of diseases. Again, for a population, the researcher divides the number of disease cases by the number of people. By doing so, this investigator will have calculated which of the following number answer is prevalence. The prevalence of a disease How do you calculate prevalence? By dividing the cases of the disease cases by the number of people. That's how you calculate the prevalence. Prevalence is number of diseased patients for the number of people. 14. Which of the following computer databases contains reference to dental literature electronically? Answer is Ovid Medline. Ovid Medline. Again, which of the following computer databases contains references to dental literature electronically? Ovid Medline. 15. In which of the following teeth does the pulpal anatomy dictate a triangular access cavity preparation? Answer: maxillary central incisor. Maxillary central incisor. In which of the following teeth does the pulpal anatomy dictate a triangular access cavity preparation? Answer: maxillary central incisor. 16. An 8-year-old child has an exposed vital but inflamed coronal pulp in number 14. The treatment of choice is, again, 8-year-old has an exposed vital but inflamed coronal pulp in number 14. The treatment of choice is, answer, pulpotomy. He has an exposed vital but inflamed coronal pulp in number 14. Treatment of choice, pulpotomy. 17. Which of the following is the least reliable finding from a clinical examination of teeth subjected to traumatic injury? 17. Which of the following is the least reliable finding from a clinical examination of teeth subjected to traumatic injury? The answer is vitality of the teeth. The vitality of the teeth is the least reliable finding from a clinical examination of teeth subjected to traumatic injury. Which of the following teeth most often refer pain to the ear? This will be a mandibular molar. Temple uppers, ears lowers. Okay, 19. 5 hours ago, a 12-year-old fell and fractured his maxillary right central incisor at the level of the gingival tissue. The exposed pulp is vital. For this tooth, which of the following presents a treatment of choice? Answer: complete root canal treatment. He's 12. He has developed his roots already. Next, for access preparation, the root canal anatomy of a maxillary second molar with 4 canals requires which outline form? Again, for access preparation, the root canal anatomy of a maxillary second molar with 4 canals requires which of the outline form? Triangular. Access preparation for a root canal anatomy on a maxillary second molar with 4 canals requires a triangular axis. Next, which of the following is the best aid in the diagnosis of irreversible pulpitis? Thermal test. Thermal test is the best aid in the diagnosis of irreversible pulpitis. Next, 22. Which of the following characterizes replacement resorption, ankylosis. Which of the following characterizes replacement resorption, ankylosis? 23. Which of the following has the best prognosis for treatment? Which of the following has the best prognosis for treatment? It gives different options. So the answer is a tooth with a small area of internal resorption. A tooth with a small area of internal resorption. The other options are an avulsed tooth that has been replanted within an hour. The other one is a tooth with a vertical fracture that extends through the floor of the pulp chamber. Next option is a tooth with external lateral root resorption. And the next one is a tooth with external apical root resorption. The best prognosis for treatment out of all these, it has the tooth with a small area of internal resorption. 24. Which of the following represents a sequence in the replantation of mature avulsed teeth? Which of the following represents the sequence in the replantation of mature avulsed teeth? The answer is repositioning, splinting, performing canal debridement, performing calcium hydroxide therapy, and filling with gutta percha. Again, repositioning, splinting, performing canal debridement, performing calcium hydroxide therapy, and filling with gutta percha. Next, the pulpal floor is perforated during access preparation. Which of the following is the best course of action? Repair the perforation immediately, continue the root canal treatment. Next, early stage periapical segmental dysplasia is best differentiated from chronic apical periodontitis by the answer is results of pulp testing. Again, early stage periapical segmental dysplasia is best differentiated from chronic apical periodontitis by the results of pulp testing. They look very alike. Periapical segmental dysplasia, and it's can look at first like a radiolucency. 27. Establishing drainage is an important aspect of emergency treatment for an acute radicular abscess. An equally important aspect is debriding the canal system of necrotic tissue. Next, 28. A maxillary central incisor of an adult patient is traumatized in an accident. The tooth is slightly tender to percussion, is in good alignment, and responds normal to pulp vitality tests. A radiographic examination shows a horizontal fracture of the apical third of the root. The best treatment is which of the following? Again, it's a tooth that radiographically shows a horizontal fracture on the apical third of the line of the root. It's a maxillary central incisor of an adult with trauma. The tooth is slightly tender to percussion. It's in good alignment and responds normal to vitality test. Answer is splint and re-evaluate the tooth for pulpal vitality at a later time. Next, a tooth with an incomplete crown fracture should be treated. What is the answer? A tooth with an incomplete crown fracture just requires recontouring of chipped enamel. Actually, I'm wrong. A tooth with an incomplete crown fracture requires vitality tests to determine the extent of the pulpal damage. I was wrong. A tooth with an incomplete crown fracture requires vitality tests to determine the extent of the pulpal damage. Next question is 30. The complete separation of a tooth from its alveolus is avulsion. Avulsion. Next, after obturation of a traumatized central incisor, a horizontal line of material in the midroot area extending both mesially and distally from the canal to the periodontal ligament space is noted. This indicates the presence of a midroot fracture. Midroot fracture. After obturation of a traumatized central incisor, a horizontal line of material in the midroot area extending both mesially and distally from the canal to the periodontal ligament space is noted. This indicates the presence of a midroot fracture. 32. A periapical radiolucency is present at the apex of a tooth with a middle third root fracture and the apical canal space is not negotiable. The required treatment would be extraction with removal of the apical segment and replantation of the coronal segment. If periradicular radiolucency is present at the apex of a tooth with a middle third root fracture and the apical canal space is non-negotiable, the requirement treatment would be extraction with removal of the apical segment and replantation of the coronal segment. A patient experienced a blow to the mouth. Radiographs show a horizontal midroot fracture of a maxillary central incisor. The tooth is non-mobile and not symptomatic, however, it does not respond to pulp testing. No radiographic lesion is present. The best treatment is to render no treatment at this time and periodically recheck clinically and radiographically. This is for a patient that experienced a blow to the mouth in which radiographs show a horizontal midroot fracture of a maxillary central incisor. The tooth is not mobile. The tooth is not mobile and not symptomatic. However, it